Hello, everyone. We're here again with an STN podcast. This morning, we're going to be enlightening you about something that's going on sort of behind the scenes that many of you are totally unaware of, but something that will impact every single one of you at some point. Once again, today we have, by popular demand, back with us Michelle Engarto. We've had Michelle before with some information about such things as the budget in Montgomery County, which she did a deep dive into and gave us a lot of facts and truth about what's going on there. She also has a lot of information about election integrity that we have shared with you. And now we're going to give you something about the Department of Health in Pennsylvania and some regulations that they've proposed. And it's actually 503 pages of regulations, which I think I commented earlier. I think Michelle's the only person that's read through every single page and highlighted and made notes. And she's here to bring us some information. Now, we will have a lot of documents attached here, and we'll show you how to get to that in just a minute. But I want to introduce Michelle and let her enlighten you as to what this specifically is that the Department of Health in Pennsylvania is trying to promulgate.
Yeah, thanks, Doug.
Sure.
This legislation, which is proposed, hasn't been passed yet, which is the point of this communication that we're doing, is to let people know before it does get passed. It's really, when it boils down to it, it expands dramatically definitions and powers of the Department of Health that are very concerning for all citizens and children. So it's impacting adults as well as children. This isn't just about children, but there's a lot packed into 503 pages, as you can imagine. It's a really major upgrade. And the Department of Health is fashioning itself after states like New York and New Jersey.
Now, Michelle, can I interrupt you for a minute? You just used the term legislation. Is this legislation that the House or Senate is voting on and passing, or is it regulations that the Department of Health is putting forward that would be in effect regardless?
Yes, very good point. It's a proposed set of regulations that fall under an existing law. So they need to make sure that they're following the letter of that law, which originally was passed in 1955. And of course, they need to be able to abide by the constitutional rights of American citizens and all of that good stuff. But the interesting thing about the Department of Health is it doesn't pass through the legislature like other laws do. So these regulations actually get submitted after public commentary period. The Department of Health will take into consideration some of the public comments. It will get reviewed by a committee or a subcommittee of legislators, but it's not a vote. It will get input from committee. And then it will go through an organization called the IRCC, which is the Independent Regulatory Review Commission, which is led by 5 lawyers who were appointed by other senior level politicians, such as the governor and minority and majority leaders in the Senate. Okay.
So this actually is put together by unelected officials.
Yes.
And the only elected officials that have any input on it is the committee that you mentioned. Mm-hmm. And they're just making recommendations.
Yes. They don't vote. Correct.
Interesting.
So there are 2 massive concerns, overlaying concerns, besides the content, which I'll get into in a second, which is massively concerning on its own. But this could, if nothing is done to intervene, this could essentially pass with 5 lawyers who were appointed by other elected officials, essentially, and then the Attorney General would put his stamp of approval on it, which I imagine he would make sure that all the laws are being followed, of course. But in terms of morality or the scope of what the Department of Health wants to do, I would imagine the Attorney General would rely on the expertise of the medical folks who the Department of Health are reaching to for advice, like the CDC, as a for instance. Yeah, and we know how that's going. So it is concerning. So, I mean, one of my asks, I was going to make it at the end, but one of my asks is, and I hear this is going on, is if our legislators and our elected officials can intervene legally on our behalf to prevent the passage of this massive overreach. That's what we need to do, because I'm not sure the law established in 1955 is going to keep people on the railroad tracks.
Well, to that point, I want to let you know that Senator Pennicuick was to be on our podcast today, but there was a conflict, so she couldn't join us. She's going to be joining us at a later date to go into some information about what the legislature can and is doing about this. But she did forward a co-sponsorship memo from Senator Brooks that we are going to provide for everyone to be able to review and read through. This co-sponsorship memo essentially is sounding the alarm and stating that the legislature is going to push back on a lot of what is being recommended here. I think they should push back on the whole thing from what I've seen, Michelle, and you're going to talk to us about some of the specifics in a moment, I know.
Yes. Yeah. I just want people to know what's in it. It's not a small deal. It's going to impact everyone within the sound of our voice in the state of Pennsylvania. If it's passed, it's going to be quite scary. And I would also say it is not an exaggeration to say this is one big giant step toward communism. And I will explain that as I go through. But this is not just about health. This is about control of people and control of our freedoms. And it's going to instill great fear. I'm already fearful just reading the proposed regulations.
Yeah, when you brought this to me, Michelle, I skimmed through a lot of the 503 pages before STN put together. We have two documents we're going to provide for you as well. One is an overview of the potential red flags in this document that STN put together. And we're providing that to all of you to review. It's quick, it's easy, and it gives you a pretty good overview, obviously, of what's in this proposed regulation document. And then we have an outline of the document. It's much shorter. I think it's about 18 pages, but it's a lot easier to go through than the 503 pages. Michelle just used a term that I think is really important for you to recognize. This is all about control. And when you hear what these proposed regulations are, you'll see that you're giving up your freedom too. This was initiated during COVID, and now they're expanding and really just taking it to an unbelievable level now on all the things that they did during COVID that will be just normal if there is any type of a outbreak or anything that they deem as a public health hazard. So I'm sorry, Michelle, I'm going to be interjecting a little bit because I'm pretty passionate about this as well. This is something that we have never seen before in our country to this degree, where it will be a routine. This is not just something that has to be, legislated due to a specific outbreak of something. This is something that they're just going to do when they feel it's necessary. So again, Michelle, I know you've got a lot to get through here, so I don't want to hold you up.
Yes, you can go ahead to the introductory slide if you don't mind. Essentially what I said is the Department of Health wants broad powers to track and control residents of Pennsylvania. If you read this for yourself, you'll see what I'm talking about. So I've selected about half a dozen or so of the concerns, because 503 pages, it's just packed full of all kinds of expansions of definitions, expansions of diseases, expansions of vaccination requirements, all kinds of expansions of powers. I'm picking out the ones that are most concerning to let you know that you can have an impact as to whether or not this gets implemented in its full form or not. And it's just important that everyone understand that this could happen. And we have a short window to respond. By September 21st, public comments are due. There are a couple of ways you can make public comments. I think the easiest way is to sign a petition, and I will have a link to the petition at the end of this presentation that you can copy. Just go sign it, because I will be submitting a public commentary on behalf of all concerned citizens who sign the petition. So I'll do that for you. You also can read the public commentary that's already there. They've been posting it as it comes in. So you'll see my name, Michelle Engarto. You can read my own public commentary. Also, I want to mention and thank Jean White. She couldn't be with us today, but she is just a hardworking, patriotic citizen who does so much behind the scenes to help us maintain our freedoms in Pennsylvania. And she couldn't make it today, but I'm also going to provide some of her highlights from her public commentary. And she's graciously offered that you can use some of her, sentences in words if you need to, just to get your public commentary in, if you agree, of course. So again, there's a link here at the bottom of the page to the proposed regulation for your reference. And I believe that, Doug, you're going to be providing those summaries as well to help people understand.
Absolutely. And just to springboard off of what you just said, Jeannie is just a gem. She sends me information virtually every day. She has significant connections with others around the state that are like-minded. And I can't say enough about Jeannie and what she's done and what she's doing. So please, take a look at what these ladies have written. Use anything you need from what we're providing with you or for you to put your public comment out there. We've got about a month to do this, and we want to flood them with public comment. And again, sign the petition that Michelle has put together, and we will provide for you. Just get involved, get engaged. Go ahead, Michelle. I'm sorry.
That's okay. Flip to the next slide, please. So here's one. So I'm going to go through. Each slide is just a different point right from the document, my interpretation of what it's saying. You can read it for yourself. The Department of Health wants broad authority to mandate masks and other measures. So what they found was during the COVID period, not too long ago, the Department of Health actually had limited powers to force people to mask, to force school children to mask. And if you remember, there was a lot of discussion of parents at school board meetings, right? And school boards had some leeway as to whether they wanted to implement or not in businesses. Well, and the Department of Health would like to be the authority and to tell businesses, schools, and citizens that they have to wear a mask, where they can go, where they cannot go. Essentially, anytime they deem that there is some kind of public threat and they want to either prevent an outbreak or control the spread of something that's already outbroken. So that gives them unlimited power, essentially, to tell us what we need to be doing for our own health. So I'm real concerned about the powers of DOH that they're asking for here, as well as the words that they added, which were prevention. Meaning, to me, prevention is you're not sick, right? We're afraid someone is on a plane, came in here with some disease. We want to prevent the outbreak. They landed in Philadelphia airport. Therefore, maybe they're going to want to tell everyone within the 10-mile radius to stay home. Maybe they want to see on Google Maps where you've been traveling for the last several days. And they're going to contact trace and individually select those who are going to be contained or isolated. This gives them the power to do so.
So, a couple things that I want you folks to remember. When Michelle talks about prevention, in my profession, we're all about prevention. And, I oftentimes use the analogy, and arguably, a colonoscopy is not a preventative measure. Colonoscopy detects if you have an issue, but it's not preventing anything. And I'm not denigrating it in any way. It's important. It does help save lives. It determines if you already have a precancer or cancerous state, but it is not prevention. No more than wearing masks is a preventative measure. I went to our school board twice and spoke to the school board about masking children in school. I found no research whatsoever about the efficacy of the masks with the current virus that we were trying to prevent. I did my own research. I found that the range of micron size of the virus. I found the only mask that we had detailed information about, which was the N95 mask, which the pore size of which was larger than the smallest 1/3, I believe, of the viral load size. So they were ineffective, essentially, even in preventing that. My clinical experience was that wearing the masks caused more upper respiratory issues and health concerns than it prevented. And if you look at the research that was done at MIT about distancing, the same thing was true. So again, when we depend on the quote unquote experts, I want you to always remember the definition that a professor of mine at Chiropractic College said. She said, an expert is in science an unknown quantity of drips under pressure. And if you think about that, it makes sense. I mean, we depend on the quote unquote experts, but unfortunately, sometimes and oftentimes, really, the experts have other reasons I'll put it that way, for promulgating what they put forward relative to a specific issue. So, again, Michelle, I don't mean to interrupt you, but this is a very passionate subject for many of us. And I think it's important that we get the information out there to everyone.
Yes. So, on slide 3, we the Department of Health also wants access to your medical records. So they do already have some access, right? Because there's some reporting requirements. They anonymize the data, or so they say, but we always know it is connected to you. It is possible to figure out where the data came from always. The fact that they don't share it with people is nice, but you can always access information if there's a data breach. The Department of Health now and local health authorities want access to your private medical records without permission when they decide it is warranted. So they would have a power to go into your doctor's office or call them, and for reasons that they deem necessary, view your medical records and even make copies and take them with them.
So, Michelle, do they define what necessary is, or them deeming it essential to do, or whatever?
Well, no, a lot of these comments are fairly general, like deemed necessary for the prevention. So again, if they're preventing something from happening, you're not going to be presenting with symptoms, or you may have symptoms. You may have a sniffle and a cough and a sore throat. But if you have not been diagnosed, that's when they're going to try to prevent something bad from happening. So to me, it expands it way too broadly, right? Because it's no criteria for what actually is necessary. If they're saying they can define it based on symptoms and conditions without listing all the conditions. So I think it's way too broad, my opinion, when I read it. The fact that they can go in there and read your medical records and take copies is very concerning. And who are these people? What are their qualifications? Also, reportable diseases. So if you are confirmed to have a disease, that could lead to contact tracing activity. So we know what that is, right? They ask, or they find out who else you've been in contact with and talk to them. And further actions that may impact you and your loved ones, including putting you in involuntary quarantine and isolation, which is written in the document.
And they don't specifically outline the diseases either, do they?
No, not to my knowledge. I didn't see a long list of here are all the diseases. And again, the fact that they're adding the words prevention is concerning, because you're not sick.
Right.
If they're preventing something, you're not sick.
This is so broad and generalized and
it is
sweeping. I mean, what happens to your health information when they take it? Where does it go? How is it secured? Who has access to it? I mean, this is just nuts.
It does instill fear. And the other thing is, if I use the example of DNA testing. I chose not to get the genetic testing when I had my DNA, because I didn't want to know if there's something lurking in my DNA. That is not a sentence to something bad happening.
Absolutely.
Right? It's going to cause unnecessary concern. And I didn't want to know, but in this case, you can imagine that if health authorities want to prevent something, they may be gathering data on conditions that are likely pointing to something bad happening, which is not a guarantee. And perhaps they'll be contacting people and saying, hey, we notice you're high risk for XYZ. I didn't ask for that. I don't need the Department of Health to parent me, right? And cause concern and make me afraid.
To your point, I'll put my other hat on, my doctor's hat. You can upregulate or downregulate those genes. I mean, just because you have the BRCA2 gene does not mean you're going to get breast cancer. This is the craziness of what we do today. Someone has BRCA2 and they go get a bilateral mastectomy.
Yeah.
And in my opinion, that's nuts. So yeah, I mean, if they're using genetic data that indicates that you have a predisposition perhaps to something, and they're going to track that and utilize that in some way to, monitor you perhaps, because I know there's more information about monitoring.
Yes.
As well. So I'll let you get into that.
Yeah. If you go to the next slide, we'll talk about surveillance. That leads me right into this. We do not have a state birth defect registry, by the way. Some people think we do. We do not. There are tests that are required when you go and you have a baby in a hospital, right? There's some reporting that's required and some tests that are mandated. You can opt out usually in writing of those tests if you choose. But there's no birth defects registry, is what they're calling it. New Jersey has one, and again, they're fashioning a lot of their communist policies are copying New York and New Jersey, and we know how that's going for them. So the CDC wants to create a national birth defects registry. They already have a birth defects registry, and they cooperate with states who have volunteered to do this, like New York and New Jersey. And there's a lot written in the document about this, so I encourage you to go read it. But basically, in my opinion, this registry is intrusive. It's mandatory for all health centers to participate. So it's not like you're going to a special hospital for a special problem. All hospitals dealing with prenatal and births are going to be required to put this information of birth defects and anomalies into a database for the state to use. And it does involve surveillance. The CDC openly admits this on their website. I went and looked it up, the birth registry for the CDC, and they admit that they do surveillance. And they claim it's for, noble goals like if we can understand environmental factors and where the people live and we can trace clusters, then maybe we can prevent future birth defects and all this kind of stuff. But they also admit that they've had no measurable impact by doing this. So a lot of times they end up creating fear in communities or about certain circumstances, which end up not being tied at all to the birth defects that they're finding. So it has not been successful. It is very scary. If you have a child with a birth defect, it states in the document that the birth defect needs to be found or categorized by age 6. So to me, that means from birth until 6 at a minimum, they're going to be tracking your child based on their ID to see what else happens in their health outcomes, so they can try to understand better the impact of birth defects on lives and longevity, et cetera. And the CDC already admits that they're doing this. And by the way, the CDC is going to give money, most likely. It would have to be approved. But there are hundreds of thousands, if not millions of dollars that will be gifted to Pennsylvania to put the birth registry in place and to hire people to manage it. So we'll expand government even further. And the other thing is the testing and the reporting for the birth defect registry includes babies that are aborted, terminated, miscarried, etc. So that's fearful for the lady giving birth to a child, right? Am I going to be culpable in some way? Was this birth defect caused by something I did? It just makes people fearful and adds to the anxiety that they already have about potential problems with their child.
Exactly. There's enough emotional trauma with someone who has had a miscarriage or has a child with some form of birth defect. They don't need the government, enhancing that trauma. And, some of you out there may think I'm a little extreme with this comment, but the first word that popped into my mind when Michelle told me about this before I even read it was eugenics. And those of you who have, a historical perspective on multiple cultures, eugenics was a way to keep your society relatively clean, I'll call it. Again, that may be an extreme on this, but, it's a foot in the door, in my opinion, in that regard. If we want to decrease our healthcare costs, there may be a certain type of defect that we just don't want to have or don't want to spend money on the rest of the individual's life. Just putting that out there, I realize that may be categorized as, tinfoil hat, but I do think that it is something that we have to at least have in the back of our minds when we see something like this.
Yes, I agree. Because bad people, if the laws and regulations aren't carefully constructed and bad people someday are in authority, it allows them to do bad things. And that's what we need to be concerned about. They may have noble goals today. We probably have a lot of good people that just want to do good, but we have to protect ourselves if those folks are not there anymore and someone who is not so good with their intentions comes in. And in the last few years, so they say that the data is anonymized, right? They always try to protect individual privacy. However, medical records are often breached. So the birth defect registry will have all these people in it, children and adults now, who were born with birth defects or other anomalies. And just in the last few years, over 193 million stolen medical records were taken by U.S. residents. That's a short period of time. So to think that this is going to be private and it's no big deal and they're just going to use the data for analysis, that's the intention. But the reality is someone is going to get their hands on that data. And just imagine if healthcare companies had access to the birth defect registry. I'll just leave that there.
Yeah, we've got a lot to consider here, folks. We really have to be engaged. We really have to be part of this process, or this is going to happen. There may be some tweaks to it somewhere along the line by others, but this is what's put out there: 503 pages of regulations that are just overreaching relative to your freedom, your health freedom, and your lives in the future. So, Michelle, you've got a lot more. So let's see if we can cover it.
Yeah, go ahead to the next. The next comment is around involuntarily quarantining and the isolation of citizens. This is one of the most frightening things in the document, for sure. It allows the Department of Health and their employees to isolate and quarantine people to control the spread of disease. And they say clearly that the measures may be used as medically and epidemiologically necessary to prevent or control the spread of the disease. So again, prevention means people are not sick, right? They're going to control the population of people who aren't sick to protect them from getting sick. They mention New York's regulation as a benchmark. I went and read that regulation and what was written about it and all the lawsuits that were started because of it. It's void of enforcement, that law. So it's interesting that they reference it and they want to copy it for Pennsylvania. A number of lawsuits were already brought based on the violation of constitutionality of that law. So it's not really being enforced, although it could be because it's still on the books. Because the prominent case was dismissed on a technicality, which is a shame. So they need to continue to pursue getting that law off the books. It gives the Department of Health the ability to use measures like masking, social distancing, cleaning, preventing access to certain locations. So if there's a business they don't want you to go in, they would have the authority to tell people they can't go to that business. This all sounds too familiar based on COVID, and they want the authority to be able to keep doing it and do it more often. And they also mention in the document that they may even place a placard on your door to your home or your office to warn others to, I guess, stay away from you. This person is under quarantine. Don't talk to them. Don't visit them. Talk about frightening. And they specifically mention in the document also that they will have the right to work with local law enforcement to enforce compliance or to manage you if you're at a risk of not following their orders.
So essentially, you have no choice in the matter.
Correct. And you don't even need to be sick because, again, it's prevention, right? If they do contact tracing, they have your medical records. They know where you've been, already being tracked everywhere with their phones. They could easily come into your house and say, you have been exposed. You need to quarantine. They'll either tell you need to stay home from work, right? Who's going to pay for the loss of wages? I don't know. You're going to stay home from work, or we're going to take you to another location. They also have the right to do that. And we will tell you when you can return to normal.
And we saw plenty of that in Australia during COVID. And we also saw many businesses close because of, quarantining, not quarantining, but limiting the number of people that could come into a restaurant, for example. I recall when I went down to Philly, I went into a restaurant and I didn't have my mask on when I walked in. And the maitre d' said, you have to put your mask on. And I said, well, the table's right there that you're taking me to. He said, it doesn't matter. You have to put your mask on. You can take it off when you sit down, which made no sense whatsoever to me. But afterwards, I got into a conversation with him and he said, we can only have 5 people at a table. And we had a party that came in of 10 people. So we had to separate them into 2 separate tables. One of the people moved their chair over to the other table. There was a health department officer who came into the restaurant. And at that time, there were 6 people at that table. We got a $5,000 fine because we didn't separate the people. Now imagine that in a restaurant that's already being limited as to the number of people they can get in.
Wow.
It's just insanity. This is counter capitalism, counter to a free enterprise system,
Yes.
just right there from a business standpoint. So this again is, in our constitutional republic, this is insanity.
It's about control and fear. I mean, when you think about it, because I don't know that there are any objective measurable results from the measures that we took even during COVID.
No. And, the other thing, Michelle, that was used was social pressure. They convinced so many people that what they were saying was 100% true and accurate, and people just bought into it. And if you were walking, you remember the one-way lanes in the supermarket. I mean, it was stupid too.
The arrows in the floor.
Yeah. But if you went down the wrong way and somebody was coming the other way, you would be chastised and, ostracized because you were walking the wrong way in a lane with ceilings that were 18 feet high and air circulating that literally, according to the study I referenced earlier, just dispersed anything that you exhaled anyway. So this is nuts.
It is scary and nuts. Yes. On the next slide, I just have two more examples. This really upset a lot of parents. I think this really motivated a lot of people to sign the petition if they can't write their own comment, or as I mentioned, do both, just to make sure. The DOH wants unfettered access to students at any time without parental notification or consent for any reason. They want to enter a school. This is very scary to me. They want access when classes are in session or any other time the person is present at the school, on school premises, or attending a school function. Now you imagine little Jane, who's 12 or 13 years old, is in a school play practicing drama, ready for a play. The Department of Health wants their employee to go in there and take her out of that activity. How scary is that? Without talking to her parents first or anyone else, pull her out of the activity, take her to a private place and say, well, we've done some contact tracing and we know that you've been dating little Johnny. Little Johnny has a venereal disease, so we need to test you. I mean, it's crazy to think that they're going to do this. That is so frightening for a kid. It totally tramples on parents' rights.
Absolutely.
To raise their own children and take care of them. The parents are responsible for the child's health, not the state. And it is shocking to me just to imagine how this might even happen. And they have no intention of telling parents, involving parents, or let alone get consent. I mean, they don't even want to tell the parents what they're doing. It's insane. And by the way, the Office of the Civil Rights at the federal level is reiterating that parents are considered personal representatives for the minor children, and they hold legal authority for healthcare decisions. And they're fighting back at these kind of laws that are trying to get passed in the states. Good. In fact, in my public commentary, which goes on for about, 6-7 pages or something, with lots of references, I actually sent by certified mail my public commentary also to Harmeet Dillon, the Assistant Attorney General, and Robert F. Kennedy Jr.'s office at the Health and Human Services, so they would be aware of what the Pennsylvania Department of Health is trying to do to us.
That's great, Michelle. That's great. Now, you spoke about, examining, but what about treatment? Can they also treat the child without formal consent?
Yes.
So, you have no oversight on your own children's health care at that point. You don't even know it's going on unless the child informs you.
Well, they're saying the child has the right to give them the permission and not be, burdened by, parental oversight. And remember, now they have the ability to diagnose them, to treat them, to quarantine them, to enter their data into a database. I don't think parents are going to be okay with this. I don't think any parent is going to be okay with this.
No, and a child has no ability at that point to be able to make a decision relative to their own health. So expecting a child to be able to give consent is ludicrous.
It's bonkers, and it's very scary, and it's just unconstitutional. It's terrible.
Absolutely.
So just a couple of key points on the next slide that Jean White had made in her comments, which I thought were really, really good. Any regulation adopted by the Department of Health must remain within the authority granted Okay, so there are going to be multiple levels of legal reviews of this regulation, but the problem is it doesn't touch on the moral aspects, right? And we don't have any representation. So I'm glad that our legislators are already working to prevent this from happening, because it's way too broad and it could pass with these crazy draconian measures if they don't try to prevent it from passing. Second of all, government actions that restrict our liberty should be narrowly tailored, if at all, right? Supported by clear evidence and subject to meaningful oversight. Public health objectives should be pursued using the least restrictive means reasonably available while respecting the constitutional rights of Pennsylvania residents. And this document clearly does not. And then she goes on to respectfully request that they revise the regulation to ensure any authority relating to surveillance, isolation, quarantine, and other restrictions on liberty are clearly limited by statutory authority. They incorporate strong due process protections and preserve the constitutional rights of Pennsylvania citizens. So very well written, very accurate and pointed. And Jean has also graciously offered that if you go, and I will as well, if you go to the public comments on the site to the link that I'm listing here, you will see Jean White's name, you'll see my name. You are welcome to use anything in there in your own public commentary if you wish. Public commentary doesn't need to be legalistic. I've seen some of the public comments are basically 2 sentences in an email. That's all you need. You can state your feelings about it. Don't be intimidated by that. Just go ahead and make a comment. If you're against this, go make a comment, please, because the comments are going to be read, and the comments, the topics and issues that are mentioned are going to have to be dealt with and responded to in some way before they publish and pass the final legislation. So please do that and pass this on to everyone who lives in Pennsylvania.
Absolutely. And, listen, just advocate for your beliefs, if nothing else. Get the word out, tell others, send this video to everyone you know in Pennsylvania and elsewhere, because this isn't just happening here. This is going to spread, as it has already, from New York and New Jersey to Pennsylvania. So you've got a responsibility now, and you have to take action. You have to engage in the process, number one, personally and yourself. You have to gain the information and insight to actively and truthfully spread this information to others. And you need to really help to move the ball forward so that things like this don't continue to happen. There are constitutional rights that we have that are being trampled on every day. This is another example of that. Our freedoms are being chipped away at little by little. We're getting the foot in the door with this. We don't know where we go after that. The big brother control has to end. We need to be responsible for our own health care and our own children as well. So, Michelle, I commend you for everything you've done with this, and Jean White as well. I know Jean is going to see this. I appreciate everything both of you have done. You're advocates for all of us, and everyone needs to really copy and paste, if nothing else, what you've done. Just get the more people that respond. Look, we have power in numbers, and the more of you that will respond, the more of you that will take action, the more of a chance there is that this will be quelled and this will not move forward, at least in the form it's in now. Our legislators are on board. Please, there's another point. Get out and vote. Right now in Pennsylvania, we have a firewall in the Senate, and that's being really targeted. There are specific races in our Commonwealth that are being targeted to take over the Senate, so that they will have the executive branch and the legislative branch and the judicial branch, honestly, in Pennsylvania. So, you guys have to get off your tails and get out there, work for the people that are, like-minded. As I said, Tracy Pennicuck is co-sponsoring this memo that I mentioned that is down below. You'll be able to get. And, just be part of the process here. You cannot stand by the sidelines and expect things to change, okay? And I often say, until it's on the doorstep of many of you, you will not even know what's happening. So I thank Michelle and others for bringing this to our attention. Michelle, is there anything else you'd like to say to everyone out there?
If you could just pop up the last slide so people can take a screenshot, there are some important links there. The public comments can be submitted by email. It's very simple, and the link is provided at the top. As I mentioned, you can write your own commentary in the simple email, or you can take snippets from Jean's or my comments, certainly, or any others, and use them in your own. And then lastly, the link to my petition is at the bottom. So if you just want to go sign your name to a petition, that makes it very easy. Please circulate these links, ask people to sign the petition, and do so again by 9/21, because anything after that is not going to be considered. And that's all I have to say. I'm glad this was brought to my attention and I had the time to be able to read it. And I'm looking forward to seeing a flood of public comments on this potential legislation. And I also look forward to, in the future, when it's scheduled, attending the Harrisburg public hearing.
Beautiful. Beautiful. We'll look forward to that. And we want to get the video of that too, because I know that's all recorded, Michelle. So we'll put that out there. Listen, everybody, get involved, get engaged. If you like what we're doing, if you appreciate what STN is all about, the people we're having on, the things that we're demonstrating to you and giving you action steps and tools to be able to work against, please support us. We ask for you to support us by sharing the videos that we send out. Our podcasts are done every other week. Please get them out there to others. It's the only way we're going to spread the word. If you can and are willing to, our donations are what keep us going. So there's a donation link that you've seen throughout this video. Please share it with others as well and take advantage of that yourself so we can stay on the air and continue getting the information out. We're going to have great guests like Michelle in the future to give you more information, not only about things such as this, but other things as well that are happening in our society, our culture, our state, and in this constitutional republic. So thank you again. We appreciate you and have a great day. Thanks again, Michelle.
Thank you.
Hello, everyone, and thank you for joining us for this STN podcast. I truly appreciate your viewership and I appreciate your support. I'd especially like to thank those of you who have recently supported us through your gifts and donations. It's your support that keeps us thriving and moving forward with our mission. Our mission, as you know, is to live up to our three core values: our biblical foundation, our constitutional framework, and our educational keystone, which locks the other two together. I know that you enjoy these programs, and I know you're learning a great deal. Our goal is to give you educational information that is truthful and also actionable. We want you to be able to move away from this program today and be able to say, hey, I've got something I can contribute that will help others. Even if it's just sharing the podcast, that's helping someone else learn. So I want to thank you again for your contributions, your donations, and your support. If you'd like to contribute today, you can click on the QR code and join us in our mission to move the ball forward. Thank you again, and have a wonderful day.